having spent 20 plus years in news sector and having switched industries from news to travel content, I actually ended up running a newsroom again as part of Culture Trip. We are not a newsroom, but obviously I have been affected as an editorial manager as everybody else. So lots of uncertainty, lots of expectations from us as managers, as people who lead other people, lots of confusion, lots of unknowns, not only on a professional level, because we also not only need to report what's happening, but we also need to be looking after the people who we are leading and who we're helping. It's about our own duty of care to our own newsrooms. It's about transparency. It's about communication. It's about clarity. It's about priorities. So all of this I would like to discuss with my fellow panelists. I would like to introduce you to Robyn Tomlin from the US, the editor of News and Observer. Welcome. I would like to introduce you to Brian Rhoads from South China Morning Post. Welcome. And our esteemed World Editors Forum leader, Warren Fernandez from the Straits Times. Welcome, Warren, as well. So everyone will have their own take on what's happening, and I would like to spend the next 50 minutes or 55 minutes or so about talking about all the aspects of coronavirus coverage, its impact on newsrooms, its impact on people, its impact on not only on physical health of newsrooms, but actually on mental health as well, how we're all dealing with it. So I would like to start with you, Robyn. Obviously, you have been in working from home for more than a week now due to your own circumstances. So over to you. Tell us what it's been like to lead the newsroom being away.
Sure. So I'm in a unique position. I run actually 11 newsrooms that are located in 4 states in the southeastern part of the U.S. And we had our first coronavirus cases emerge about 2 weeks ago. And, we were not entirely sure. We started talking then about what happens if we need to, be able to work remotely, thinking it would be, 2, 3, 4 weeks away. And then last Tuesday, we got an alert that several of our staffers who were located in 3 different newsrooms that I work with had been at a conference where someone had tested positive, the NICAR conference. And suddenly we realized that we needed to shut everything down pretty quickly. Obviously we quarantined those folks and basically moved those 3 newsrooms to fully remote and started talking about what we needed to do to move the remaining newsrooms to fully remote. Because we didn't have a lot of time, I mean, I think some newsrooms have had, days or weeks in a couple cases to think about how they would do that. It was bumpy the first few days. We had a lot of staffers who, they had laptops and they had Wi-Fi, but they may not have had all the applications that they needed on for IT. They didn't know how to use Hangouts. They were, confused about, some of the communications that were coming out. And quite frankly, they were dealing with a lot of their own personal circumstances as schools started to close down and they had kids at home. And so we really have been working hard to try to really address both the structural and communication needs within our newsroom, really focusing on making sure we're doing twice daily email communications in each newsroom with what's going on. We have twice daily Hangouts. We're using Google Hangouts for our news meetings, and we're asking everybody to attend, not just editors. We have our editors group actually stays we have a background Hangout where everyone's muted and the sound is off all day long. So anytime there's something happening, we can just unmute and have a conversation as if we're sitting next to each other. There are plenty of other technologies where you can do that, but and we use Slack intensively. And Slack is our, constant communication channel. And all of those things have really helped. The one thing that I've heard from staff is, we have tried to be really clear with schedules, what we expect from people in terms of the schedules that they're working. We've been really clear about what we expect from them in terms of the safety precautions that we need them to take. Those who are able to go out, some are, some aren't right now. We have a number of people who are in quarantine. I have one staffer who was at that conference, actually, who has not been able to get tested because testing has been such a huge issue in the U.S., but she's sick, and we believe she probably has the coronavirus. And so, you know, it's been a constant sort of cycle of trying to check in with people, make sure that they're doing okay physically, mentally, and then that we're just communicating like crazy. We have gone to staggered schedules so that we're covering more hours in the day. And most of my newsrooms are very small, and I think this is really important. You know, I have 11 newsrooms, but they range in size from 10 people to about 50 people. And so we are really working together and using editors from one newsroom to cover, you know, late night or early morning shifts in other newsrooms to make sure that people are getting enough sleep, because that was a problem in the first week or two. From a production perspective, just a couple things that we've done that I think have been really successful. We started a twice daily newsletter where we are rounding up the key insights that we believe our readers need to know. We're obviously doing all of the news alerts and the app alerts and the you know, email alerts and all of the other things as new developments happen. But we're hearing from readers that, you know, sometimes all of those constant alerts are stressing them out. And so one of the things we're trying to do is de-stress a little bit by saying we're going to give you a roundup twice a day that tells you what you need to know, that's focused both on the urgency and the breaking news that's happening in each of these communities, but then also really intensely on the utility, things that we really want people to focus on, about, you know, how they can protect themselves, how they can, you know, what they need to know about. You know, they've shut down all of the restaurants, and you can still go to the groceries and things like that, but you can't go to restaurants or bars here. So how do you get food? You can drive up and get it. So we're giving people lists of how you can get food, how you can help, and how you can anything you can imagine. We're trying to really focus on utility.